Now we have the next debonair of Bombay, Dr. Abhijit, a prolific surgeon. Today, everyone is talking about the robotic cataract surgery and its definite advantages over the regular surgery, in spite of being a good cataract surgeon. And he, with a lot of experience with flacs, he is rightly, properly, appropriately positioned to tell us, where does flax stand today and the current status of it?
So, Anaga, wonderful talk. Uh, she's already put a point across saying that flax makes her life so easy if it's a subluxated or a dislocated lens. Uh, the science is basically the femtosecond laser, which works at a very high speed, and before you know, the entire capsulotomy is done, or it's cutting the nucleus, or it's giving us the incisions as well. Our problem with the manual phaco is which is the most important step of phaco surgery. So every experienced surgeon would say each and every step, but the most important one is the CCC size and shape and centration. Now, especially considering the new advanced monofocal IOLs or the EDOFs or the multifocals. So you can't just say I don't have a problem. Everybody has a problem with the CCC one day or the other. For me also as a manual surgeon for so many years, there have always been cases which have gone slightly peripheral, or maybe I don't have the right overlap over the lens. So that's something that gives that you would get with a femtosecond: accuracy and consistency. So the consistency that a manual hand doesn't give is given by the machine. So you get the perfect CCC of the perfect size in each and every case, and you also get consistent SIA. You don't have any change in the wound construction from case to case, or a premature entry from case to case. Every patient gets the same size, the same length of the incision in the on the cornea. So I just have put this across about the docking system and the way it works in my machine. Every machine would have a different way of working, but I would prefer a machine which gives me the corneal incisions as well and corneal applications as well, because I can maximize out in complicated cases, hard nucleus cases, zonular dialysis, or even with arcus or a posterior polar. Like this is a lenticonus case which we were doing, and we found it very useful in cutting the nucleus and removing the nucleus and implanting a multifocal IOL. So your chances of implanting premium IOLs increase when you have more accuracy and more consistency in your nucleotomies. If you are doing Varion assisted, even LRIs or corneal, if you have the Varion posterior corneal curvature adjusted, arcuate keratotomies is what it offers, and that is something that you can give more predictable and more long-term results using the AK for small astigmatism. So what is the market size? When we're looking at femto, the entire world is a market because cataract dense population is there everywhere. And this is one machine which can be used and advised for all your cataracts. And you have huge volumes to target. So our problems is, first, phacoemulsification is promoted as laser. You have a capping on insurance, and time and space required is much more. So the amount of time for counseling automatically increases out here, and the cost for each surgery also increases. So how do we tackle this? So the magic word is laser. Again, though even though the phacoemulsification is already known as laser, everybody wants a smartwatch. That's the way even this would work. So using the science for the commerce, uh, you should buy a laser which has multiple uses, because that decreases the cost across. Uh, you should have the ones which are effectively used for incisions and flap, and you need to increase the volume so that the PI cost decreases, and so does the cost of the procedure. And that's how you would place your femtosecond laser surgery. So intermittent marketing is something that I did actively. We coined the word bladeless cataract surgery because for all our femto cataracts, we are doing incisions, and for none of them we've ever had to use a keratome to make an incision. It's not truly a robotic surgery, but there are people who promote it as a robotic surgery. It works well for many people, but we talk about accuracy out here. So we counsel in the same area whereas the flax is kept, and it's a transparent cube. And we show the procedure on the tablets, and we tell them that, okay, this is where you're going to be operated first, and then you're going to be transferred to the other theater. And we use flax as a term for all our patients rather than a robotic surgery. We have multiple options for these kind of machines, especially the Z8 now is supposed to be a very good machine because it also gives you the option of smile or a lenticule extraction for the refractive procedure. So the business model, safety is the buzzword. Whatever and however much we may try, a manual surgery is not all the time 100% safe. So is not flax, but at least it's a step forward. Target your own patients first and then the media. The media likes testimonials, so you need to have your testimonials from the existing patients that you've operated. And to summarize, femto with cataract and corneal applications are the preferable options. The revenues generated are shared, and so are the losses when we are talking of multiple procedures. So one procedure pays for the other. And both cataract and LASIK grow together. So femto or similar is here to stay, and we need to accept it and accommodate it. Thank you.